Hi, my name is Santhosh Paulus. I am a family medicine physician and I work at Huntington Hospital within Northwell Health. I am the Senior Program Director of the Human Trafficking HEART Program, which stands for Human Trafficking Education, Advocacy, Response, and Training. I'm also the founder and president of a not-for-profit called Cycling for Change. We had biked from Washington State back to Long Island in 2015, and I'm also a board member of ECPAT-USA. What compelled me to get involved. And so this goes back to a combination of three separate events that kind of pushed me towards this work. My wife is an author, and Rajdi Paulus, she was blogging for an anti-trafficking organization called Know Me Network, and that was where I first started to hear about just the evil and the issues of the heinous crimes that happen with human trafficking. And so I was at a music festival up in New Hampshire where there was an anti-trafficking organization from the Boston area that was sharing what their organization does, and this was in 2013. And I'm a father of 4 girls, and so I was just very impacted by what was being spoken from the stage. In my direct line of sight, I can see my 4 kids. They're mentioning ages of the average age of entry, and it just really impacted me. That was kind of like one event. Another event that happened was on New Year's Eve. We have a time with the family, and we talk about our goals, 1-year goal, lifetime goal, 5-year goal, and things like that. And I had mentioned that in my lifetime, I wanted to be able to be in a financial position to be able to sponsor 100 kids on a monthly basis, which is obviously a very expensive situation to be a part of something like that. But that was my lifetime goal, to be in a financial position to do something like that. The third thing that kind of brought all of this together was I was in a situation where I had an opportunity to teach Sunday school to 8th grade boys, and we were going through different characters in the Bible, and we were talking about Noah and talking about the ark that he built and how it was just something crazy and just huge, and people laughed at it and said that's just impossible. And I just challenged the kids on, like, what's your ark? And I just felt I left from that time and didn't have my own ark. And I thought about it during the course of that week, and all these ideas just seemed to converge together. And I said, why do I have to wait till the end of my life to do something that's huge? And this idea came to me to bike across the United States and be able to support Know Me Network, which was the organization that my wife was blogging for. It just made a lot of sense, and do something now rather than waiting till the end of my life. And it bothered me that it made so much sense, and I'm like, but it seems impossible, it seems crazy, it seems like people are going to say that's insane. And I'm like, isn't that the exact thing that I challenged these kids on? And I said, I think this is my arc, this is what I want to get involved in. And that was what happened. Looked for people to bike with me, and next thing we knew, had 40 to 50 people supporting Cycling for Change, and just a bunch of volunteers, and all of a sudden it grew to what it is today. And up to date, we've given out nearly $120,000 to organizations on the front lines of fighting human trafficking. And so that is kind of a little bit about how I first became aware of trafficking and I got involved. As far as a physician, the work that I was doing in the community kind of spilled over into my work in the hospital and the health system. I attended a conference in Kansas City where I heard Dr. Ronald Chambers speak on a medical safe haven for survivors of human trafficking. And he shared what they had done at Dignity Health out on the West Coast. And I brought some of those ideas back to Northwell. Spoke with Michael Dowling, our CEO, as well as Mark Salazzo. And they just really put me in the right position to get connected with folks within Northwell leadership to be able to implement a pilot at Huntington Hospital that became a task force and then became a response program within Northwell, and it morphed into what it is right now as a medical safe haven for human survivors of human trafficking, the HEART program. The issues of initiatives that we've taken at Northwell, a particular program that within the HEART program that I'm very just proud of that we've been able to implement and to be a part of would be something that's just in its early stages right now. We are working with the behavioral health service line to create just services for survivors of trafficking, where they might be able to receive mental health services. This is such a huge need and seems obvious, but it gets complicated when you get into the weeds of actually making it happen, as many patients are uninsured. This is a project that we've been working on for a little while now, and I'm happy to see that it's starting to get take off and to have actual substance. That, along with we have a tattoo removal service that we are offering through Northwell Health, and the essence behind it is this gets into like one of the other questions that I had is like, why do I have hope in terms of the future in this work? And that is because of working with organizations like SCATI, which is a Suffolk County Anti-Trafficking Initiative here in Long Island. They let us know some of the needs they have for their clients and for the survivors of trafficking that they're working with. And they present those needs to us. And as a large health system, Northwell Health is a 23 hospital health system spanning 8 counties. We have close to 80,000 employees, and we have a lot of resources. And so when there are simple needs that are not being met for survivors, I have hope that we can actually do something and actually make an impact, because we have a lot of resources and there's a lot of needs, and then we're able to actually have these conversations and then find actual practical applications and resources and meet those needs. And that's where I have hope for the future, is because we're able to work together on these kind of issues. And by working together, we can actually address this public health crisis that we have within the anti-trafficking work that we're doing. Most of the community-based organizations that we work with, they tell us that they need to have referrals. They need to have people send them somebody to be able to assist and help them. But within healthcare, we're in a unique opportunity where patients are coming to us and we just need to be able to identify them. There was a study done through Loyola Health, the Annals of Health Law, that said that 88% of human trafficking survivors presented to a healthcare setting while they were in an active trafficking situation but were not identified. So that means that within healthcare, we just need to recognize who's coming to us. We don't have to go looking for them. They're coming to us. We just have to be able to see who's in front of us. And we often talk about this in our trainings. If we don't consider human trafficking as part of our differential in our diagnoses when we're talking with patients, if we don't consider it, we're not going to identify. And so that's why it's so important within healthcare that we're able to do this. And I'm just excited, as being a part of the ECPAT board, to be able to partner further and just do a lot more with Northwell, with ECPAT, and with Cycling for Change. In 2025, we're planning a cross-country challenge. It's a cross-country tour. We're calling it the Hope Tour. And I'm excited to have Northwell and Cycling for Change, ECPAT, and Clean Slate Living, all organizations that are doing great work, to be able to work together. And finally, I'd like to kind of share a story with you that gives me hope, that kind of encapsulates everything that we're doing within the HEART program at Northwell Health. We had a patient that had presented to labor and delivery who the nurses were very concerned. Seemed like she was in a trafficking situation, but patient repeatedly denied that was not the situation and just did not acknowledge that she was being trafficked. And did not want to accept any resources. Everybody was very frustrated by the situation. And I just encouraged the staff that, we need to trust the patient and trust that, her autonomy and her just ability to make her own choices and decisions. And if she is not disclosing and is not wanting to be connected to resources, we cannot force this on her. And everybody felt uneasy about it, but they kind of went with it. A month later, the patient returned and said, I am in a trafficking situation and I want to get connected to resources. And, I bring up this story because I feel like it shows the success of the HEART program in being a medical safe haven for survivors of trafficking, that people feel safe to return and to get connected to resources, and that trust and rapport is established, and that we're able to just connect people to the resources that they need, and trusting that people know their own situation. They're the expert of their own lives as to knowing when and how they can get themselves into a safe situation before they might want to disclose or before they want to accept resources. And so for those of us within healthcare, we need to trust our patients when they're coming to us, that they are the experts in those situations. And, offering hope for them is important, because they need to have people around them to offer them hope. And like in Cycling for Change, we always say, we know that hope changes everything.